welcome dear students. I am Richa Shakya, Assistant Professor from Noida Institute of Engineering Technology, Pharmacy Institute, Greater Noida. Today I am here to deliver the lecture that is subject Pathophysiology, and the subject code is BP204T, and this subject comes under Dr. APJ Abdul Kalam Technical University. Now, so for the today's topic for the presentation is the disease of bones, and this is a lecture number 25, and this unit and this topic comes into the unit number 3. So, the topic is the disease of bones and the joints. So, in this we study about what is the diseases regarding with the bones or the joints. So, basically here we study about the rheumatoid arthritis, right. Here we are studying about the what is rheumatoid arthritis, what is the cause of rheumatoid arthritis, what is the pathophysiology of rheumatoid arthritis, and lastly we discuss about the treatment of the rheumatoid arthritis. So, now we study about in this introduction we study about what is arthritis, right. So, now start with the introduction part. So, basically bones is the part of the skeleton system. There is a 206 bones into the skeleton system, and the entire body is make with the help of there are different types of systems. So, there is a bones, muscles and joints make up the musculoskeletal system along with the cartilage, tendons, ligaments and the connective tissues. So, the body is made up of different types of systems. So, basically if we talk about the arthritis, so we have to study about the bones, muscles, joints, and this all terms includes the musculoskeletal system. Now, this systems gives the body its structure and supports, lets to move around and lets to take some steps forward or backward, right. So, now the part of the musculoskeletal system grow up and change throughout the life. So, this includes changes throughout the life, because a person grow up, as they grow up the muscle size, the bone size will increases, and the person get at the age of 15 or 18 or adolescent age, the growth will stop, the height growth will stop, but still the continuous process of the formation or the breakdown of the muscles will continuously goes throughout the life, right. So, the part of this musculoskeletal system changes throughout the life. Injuries and various illness can damage the bones, muscles and the joints. So, there are some disorders that affect the joints, some conditions that affect the joints, some that is known as the osteoarthritis, right. So, what is osteoarthritis? So, this type of arthritis is more common with the age of the most often in the knees, hips, finger joints, big toe joints. So, osteoarthritis means it is arthritis is a more common with the age as the person grow up. So, there is a pain in the joint regions. So, it is common with the age. So, it is common with the age, and the most often affects the knees, hips, finger joints or the big toe joint, right. Now, rheumatoid arthritis, which we have to study in the detail. So, rheumatoid arthritis is an autoimmune disease which and where the immune system attacks on the lining of the joints. Now, septic arthritis, and this type of arthritis caused by the any kind of bacterial infections, that is known as septic. Now, psoriatic arthritis. So, psoriatic arthritis is a type of inflammation arthritis which affects the people who have the psoriasis. So, the person who has psoriasis is suffering from the psoriasis arthritis. Now, next is the ankylosing spondylitis. So, it is a condition affecting the joints of the neck. spondylitis means this is a neck is cervical area. So this area is known as the neck part. So there is a pain into the cervical area of the neck, joints, spine and pelvis, causing the back pain. Now sprains, so where the ligaments that connected and stabilize the bones of joints are stretched or torn. So what is sprain? Sprain sometimes what happen at that time ki the sprains will get on. So what do you mean by sprains? When the ligaments are ruptured, when the ligaments which are connected with the bones or connected with the muscles, they are just tore just because of any high much of stretching. Now last one is a gout. What is gout? So gout is a painful condition where the small crystals of the uric acid get deposited into the joints. So they are deposited into the small parts of the joints, and they cause the very severe pain, and this occurs again with the age, and this causing the pain, redness or the inflammation on the infected area. Now if we talk about the rheumatoid arthritis, which is the main part, so this rheumatoid arthritis is the chronic, and chronic means, as you already know, chronic means a long term. So this disease that can cause the pain and swelling in the joints. This rheumatoid arthritis is an autoimmune disease where the immune system does not recognize the tissues within the lining of your joints of the body part that attack. Means it is an autoimmune disease where the systems get not active, so that the particles or the foreign agents will attack on that particular area, and the joints will become swollen and it will be very painful. Rheumatoid arthritis usually affect smaller joints such as in the hands, feet, but can also affect in the large joints like knees and the hip bones. So basically this rheumatoid arthritis, basically they occurs in the small joints, just like in the finger joints. This is a hand joint, this is a finger joints, there is a pain in their small joints, but they also attack, they also affect the lining of the joints, that is a large joints, kneecaps, there is a patella, that is a kneecap, hip bones, there is also pain of the joints. So rheumatoid arthritis is different from the osteoarthritis, because when immune system attack on your joints, while osteoarthritis, when the cartilage that protect the joints to break down. So that is the osteoarthritis and the rheumatoid arthritis. So this is the cartilage, right? This is a venous. So what happened at that time? This is a healthy joint where the everything is okay. So there is a no rupture, there is a no pain, there is a no deposition of the uric acid or something else, there is nothing. But if we talk about the rheumatoid arthritis, right, what happened at that time? There is a bone erosion, right? There is a bone erosion, means there is a bone can deform, right? Now swelling, inflamed synovial membrane. So here there is a synovial membrane which have the synovial fluid. So this synovial membrane get swelled up, and the synovial fluid will get reduced. The synovial fluid when get reduced, so the synovial membrane will get inflamed. Now this cartilage will wears away, means this cartilage now wears, this cartilage will tear, right? Now reduce the joint space. So as you able to see the specific gap between the specific space between the both of the bones, but at that time what happened? At that time there is a synovial fluid will get reduced. As a synovial fluid get reduced, the two bones are get attached, and when the person is take a movements, there is a some sound, there is some cracking sounds. It is just because of the and the breaking or the swelling of the synovial membrane, or the reducing of the synovial fluid. So, there is some tick 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 sound just because of this friction between the two bones. Now, symptoms of the rheumatoid arthritis. So, there is a pain or swelling in the joints of both hand or the both feet, especially in the small joints, right, especially in small part of joints of hands and feet right. Now, stiffness in the joints. So, stiffness in the joints means there is stiffness in the joints of longer than 30 minutes after the wake up. Now, symmetry with the same joint of both side are being affected. So, the both symmetrical part of the body will get affected just because of the loss of the fluids. A flu like feeling when the entire body ache. Now, etiology. The exact cause of the rheumatoid arthritis is still unknown, but there is a autoimmune disease. This is a major cause. There is some major cause, but still the specific cause is still unknown. So, however, it is believed that the cause of it is just because of by the combination of the some following factors: genetics, abnormal immunity, the environment, and the hormones. So, these are the 4 main categories which we include in the etiology of the rheumatoid arthritis. That is a genetic, or it's just because of heredity. Abnormal immunity, because a person is not very high immune responsive, very high immunity. The environmental conditions, the condition is not okay. And there are some hormones also. Now, normally the immune system protected the body from the disease, but in the people who have suffering from the rheumatoid arthritis, something possible, the infections just like cigarette smoking, physical or emotional stress among them, the cause of triggering the immune system to attack the joints, sometimes some other organs. So, gender, just like gender or heredity and genes are largely determine the person risk to developing the rheumatoid arthritis. Just like, for example, women are about 3 times more likely prone to the men to develop the rheumatoid arthritis, right. So, women's are so the women are more likely to prone with the rheumatoid arthritis as compared with the men. Now, if we talk about the pathophysiology of the rheumatoid arthritis, so there is a foreign agents enters into the blood or into the body, and this attack on the again CD4. There is I told you there is some CD4 and CD8. So, always they affect on the CD4, not in 8. So, when these antigens attack on the CD4, they go activation of the macrophages, and they again activate the B cells or the T cells. As the B cells and the T cells get activated, they initially shows the hyper immune response in the blood, and there is a formation of immune complexes, right. So, this is a there's some 3 phases, there are some 3 mechanisms. So, there is a activation of B cells or T cells. Over here they shows the hyper immune responses. So, they forms the immune complexes. Now, if the CD4s get affected, so the activation of the macrophages, there is an initiation and the recruitment of the pro-inflammatory cytokines, that is a TNF alpha, interleukin 1 beta, interleukin, necrosis factor kappa B. So, these are the some pro-inflammatory mediators which can get activated, right. So there is a second kind. Now third one is the activation of the endothelial cells. So whenever the activation of the endothelial cells, they get leads to the increase the suppression, there leads to the expression of the adhesion molecule. Now this adhesion molecules, inflammatory cells begin get accumulated, all the cells get accumulated, and all these are cause the pannus formation, and this level lipids of synovial membrane will increase the arthritic patient as compared to the synovial membrane with the healthy patients. Now this is cause the rheumatoid arthritis. So this is the entire pathophysiology of the this rheumatoid arthritis, right. So first of all, antigens get attack on the immune system, the CD4 cells get affected. As the CD4 cells get affected, they activate the macrophages. These macrophages get activate the pro-inflammatory mediators, and these pro-inflammatory mediators can cause the rheumatoid arthritis, right. Now there is some phases of the rheumatoid arthritis pathophysiology. The first phase, there is an interaction between the genetic and the environmental risk factors with the rheumatoid arthritis, and this second phase, production of the rheumatoid arthritis on auto antibodies such as rheumatoid factors, that is RF, and the anticyclic citrulated peptide, that is anti-CCP, right. In the phase 2, in the phase 3, there is a development of the arthralgia joints stiffness without any clinical evidence of the arthritis. In the phase 4, development of the arthritis is one of the two joints that is undifferentiatedly arthritis, and if intermediate are arthritis at the stage of term as the palindrome or palindrome rheumatoidism, and is a phase 4 established of the RA. So this is the pathophysiology of the rheumatoid arthritis. Now there is a synovial fluid, which is, I already told you, there is a bone, where there is a patella bone, and here there is a synovial fluid. This is the synovial membrane, right. So whenever the person get affected from the rheumatoid arthritis, so synovial cells hyperplasia, what do you mean hyperplasia? The size of the cells will increases. So hyperplasia, and endothelial get activated at the early event in the pathological processes, and to control the inflammation and consequently cartilages and the bone destructions, right. Now genetic factors and immune system contributes the abnormality in the disease propagation. Now next one is CD4, that is CD4 T cells, mononuclear phagocytosis, fibroblast, osteoclast, and the neutrophils play the major role in the cellular pathophysiology of the rheumatoid arthritis, where the B cells produce the antibodies, right. So basically the CD4 cells get affected. At that time what happened, the mononuclear phagocytosis, the cells which is are mononuclear, they are phagocytosis by the these phagocytic agents. Fibroblast, osteoblast, and neutrophils play a major role in the pathophysiology of the rheumatoid arthritis. Now abnormal production of the numerous cytokines, chemocytokines, and the other inflammatory mediators has been demonstrated in the patient with the rheumatoid arthritis. That is the tuber, there are some different types of mediators, there are some different type of inflammatory mediators, that just like tuber necrosis factors, that is a TNF alpha, tuber necrosis factor alpha, interleukins, interleukin 1, interleukin 6. This interleukin 6 cause basically in the fever, right? There are different kinds of interleukins, there are different kinds of their functions on the immune system. So interleukin 1, interleukin 6, interleukin 8, transforming growth factor beta, there is a TGF beta, fibroblast factors, there is a fibroblast growth factor, there is FGF, platelet derived growth factors as a PDGF. ठीक है, so there are the some there is some abnormal production of the numerous cytokines. These are the cytokines which are shown, which are active, these inflammatory mediators which cause the inflammation over the different types of the joints. There is a large joint or the small joints. Now, rheumatoid arthritis, how the rheumatoid arthritis will get diagnosed. So, first is a morning stiffness. If the person is wake up in the early morning and they feels very tiredness in the early morning and they feels the stiffness in their the joints. So, this is the first primary symptom, right? So, morning stiffness that lasts at least 1 hour and present for the last 6 weeks. If the person suffer from the stiffness early morning and it is continuously with the 1 or 2 hours, and this seems with the last week, within the last 6 weeks, means almost 1.5 months. If the person feels same thing in with the entire month, so that is the first primary, this is the primary symptoms of the rheumatoid arthritis. Now, swelling of the 3 or more joints for at least 6 weeks, swelling of the wrist, hand, finger joints at least for 6 weeks, swelling of the same joint for the both side of the body, changes in the hand whenever the person goes for the x-ray. So, there is a change in the hand x-ray, that is the hallmark of the rheumatoid arthritis if there is a asymmetry condition, right? Asymmetric condition. So, there is a, if the person goes for the x-rays and the person get change the shape of the hand or the shape of the part of the body at which they get their x-rays. Now, next is rheumatoid arthritis nodules, lumps, where there is a lumps on the skin. Blood test, if it is positive for the rheumatoid arthritis factor or anti citrulinated peptide, that is CCP, and there is a protein antibodies. Now, so these are the diagnoses by which the person get diagnosed with the rheumatoid arthritis. These are some primary, there is some three, there is a primary symptoms by which the person get diagnosed without any kind of medical help. But the person then with the help of medical help, just like the x-rays, just like the CBD test, CBC test. So, these are the medical help for the diagnosis of the rheumatoid arthritis. Now, pain, for the treatment of the this rheumatoid arthritis, the person will treat it with the different types of medications. The first is the pain relieving medicines, just like paracetamol, because this because in the condition of rheumatoid arthritis there is a severe pain into the joints, right? So, there is a pain relieving medicine just like paracetamol, because paracetamol work as the antipyretic as well as anti-inflammatory, right? So, because in the condition of rheumatoid arthritis, the person got a fever because of because of interleukin 6. So, paracetamol given for the pain relieving medicines. Omega 3 supplements. So, omega 3 supplements, this type of fat naturally found in the food, such as certain kind of fish that can take as a food supplement with the help with the supplement to reduce the help in the pain removal of the pain and the stiffness of the joints. Now, next in the steroidal inflammatory non-steroidal anti-inflammatory drug, that is the NSAIDs, or the cyclooxygenase 2, that is selective 2, that is a COX-2 inhibitors. So, these are the pain relieving medicines that our doctor might be prescribed when the paracetamols are and supplements are not work in the reducing the pain and the stiffness of the muscles. So, these are the medicines, these are the medicines or the drugs given to the patients who are suffering from the rheumatoid arthritis. So, this is all about the rheumatoid arthritis with the pathophysiology and their treatment. Thank you.